Hello and welcome to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Our guest today is Dr. Tiffany Butler, and she's a chiropractor. Welcome.
Thank you.
So, of course, on television, all of my life, when we think about chiropractors, we think of whatever these TV images are. And some of them are like, you see the chiropractor go behind somebody, squeeze them, and something happens with their back. Or these death machines that lengthen the spine. But that's not what chiropractic medicine is all about.
Right, it's not. So chiropractic is a form of healthcare that emphasizing restoring and maintaining your health by spinal adjustments. So putting your body in the best position so that it can heal properly.
What does the spine have to do? It has everything to do, but I'm asking you, what does the spine have to do with maintaining good health?
Well, the main thing is your posture. So we have the spine to keep us in an upright position, and we have these muscles that are on our torso, on our arms, to keep us in movement. If the spine is not healthy, we begin to break down. That's what we call dis-ease or dysfunction. So you're not going to be able to function properly if you don't have a really good spine.
You see people at work and we're hunched over our computers for hours at a time, and it causes bad posture.
Right.
So what can we do to be mindful of our posture as we go about our day?
So the main thing is awareness, just simply being aware, like, oh man, I'm slouching, let me sit up. And getting up and moving around, whether setting a timer before you start to feel aches and pains. A lot of people, they'll sit there and they're sort of like, they start rolling. So that's time, okay, I need to get up and move around. Pointers at work, so readjusting your monitor, having it either the top at eye level or a little bit higher will be good. Making sure your chair is actually good. It's not leaning on one side more than the other. So very neutral position.
So you should adjust your chair, because a lot of times I come in to my other job and whatever position the chair is in, that's the position I'll sit in. I don't readjust.
Right.
I just go with whatever the last person who was sitting at that desk does, and you end up not sitting properly.
Right, and you'll start to have pain. So that's a micro trauma. So over time, you may not have any back pain, and you're trying to think, what did I do to cause the back pain? Well, if you're sitting and you're leaning every day for 8 hours in one position, your back is going to start hurting. So I always say, try to fit the worker to the desk. You know, so if you got to change, you get a new chair, a new desk, do that, because the worker, if they're going to have pain and aches, they're going to miss out on work, which is going to decrease, productivity.
What does slouching do? What exactly does slouching do with your body? So
when you slouch, your breathing becomes shallow, which is not going to give enough oxygen and blood to your tissues. So when you're in this type of position, and you're going to start to develop pain in your back area and headaches and things like that. So in the shoulders, even pain in the front of the chest area, just from being in a slouch position, because you're not really supporting yourself properly. So what happens when you sit up? So when you sit up, you start to breathe better, and you look better too. When you're slouched, you look sad, like you're depressed or in pain. But when you slouch, when you sit up straight, you look like you're confident. And you really believe in yourself. If you look at any athletes, you could tell some of them when they've been defeated and they lost, because they're like, oh man, versus some who just like, it was okay, it was a good game, even if they lost. So that posture position is very important to sit up. We talked about posture when I was a kid, and sit up straight in your chair, but it's something that we neglect once we become adults. Right. I agree with that. I believe that it's because, children, when they're very young in their development, we allow them to wander around and do whatever they want. But once they get to a certain age, but it's like, okay, sit still. Well, they can't sit still. So you spend all those years through school sitting for so long that you begin to slouch, and then the backpacks too, hanging off of your back. And so if you see the teenagers, they're like slouching, really bad posture. And when they take the pack off, they're still in this slouch position. We do the same if we carry briefcases or women wearing purses, always on the same side, putting that purse or that bag, and then you're slouched.
So should you switch sides with your purse?
You should switch sides, or just, don't carry everything with you. You just need your ID, some money, and just have a handbag. Really carry it in your hand. Don't put it on your shoulders.
And that's very important news as far as the kids are concerned. We have these kids in these backpacks with 30 pounds of books.
Right. Right, that's a lot, because if you're in school from 4 years old all the way up until you finish college, which is 20, you know, to when you're 22, that's a lot of time to have load on your back. So I always recommend to put, if you're wearing the backpack, to pull the straps really tight and to wear the pack high on your back, and then carry some things in your hand and wear both straps, not just one on one shoulder, because kids will start to develop headaches and back pain. They may not tell mom or dad, but if they're laying around and not being as active, they may have some pain or discomfort.
And they may not know what's wrong.
That's true.
Now, speaking of kids, you have a kid's book that's out. What's the name of the book?
The Adventures of Joshua, Spencer's Spine, and the Back Attack.
Oh, what is it about?
So it's about a young boy who accompanies his parents to the doctor's office, where they meet a special doctor who introduces Joshua to Spencer's spine and the infamous back attack. So he learns about spinal care, spinal hygiene, how to lift properly, and how to prevent a back attack from happening, and what to do if you do experience one.
What's back hygiene?
So with the foods you eat to keep your bones healthy. So your spine is the bones, and then you have the disc that's in between, which is sort of like a jelly donut. The outside is cartilage, but the inside, what will be jelly, is water. So you want to make sure that you're hydrating and you're actually working out, doing some type of physical activity, because that's what actually makes the bone stronger, by putting weight on it.
So as we know, kids are growing and developing, and some permanent things can happen because they're still growing.
Right, and I am anti-tackle football for children until they go to high school, because they are still developing. And a lot of times the kids will go out and play and they get hurt, but they don't tell their parents that they're hurt. I've had so many patients who had injuries when they were children, whether it was like, oh, I dislocated my shoulder, but I didn't tell, or I was swinging and I felt the swing and I really hurt my back when I was younger. So now they develop the pain later.
And so what can you do?
Well, I would say with the parents, so when they're doing like a regular medical screening, if they're screening for scoliosis, but look at your children's clothing. So if they're standing and their shirt's like hanging off the shoulder, you know, may have some scoliosis going on, you know, or if they're just look and see how they're moving, because that's how you really tell. If they're walking kind of funny or sitting kind of funny, then get them checked out.
What is scoliosis?
Scoliosis is an abnormal curve in a spine. So you have the S-shaped curve, and it varies from degrees. So it can start off when they're young, and then their body can adapt because it's abnormal, or it may develop over time. So the screening is important. I'm not sure if they continue to do it. So that's why I always recommend, if the child is growing, because their joints are still developing, to at least get them checked out once a year from a chiropractor, or go primary care physician, just ask them, can you at least check to see for the scoliosis?
One thing that many of us do on a regular basis is we're lifting things, whether we're lifting groceries, whether we're taking something out the trunk of the car, whether we're doing some cleaning of the garage and we're lifting heavy items. But a lot of times we don't lift correctly. What is the proper way? And we can damage the back, the spine. What don't we do correctly when it comes to lifting?
People do not bend their legs. They don't bend their knees to use your legs, which are much stronger than your back, to lift the load. Anytime we bend forward, the joints of our back open up, and they're not being supported by the muscles and the soft tissue. So when you bend forward and you like that, if you pick up a pencil, it may not hurt. But if you bend forward and you pick up 30 pounds without using your legs, you're going to feel the pain in your back.
And so you should start with the legs.
Right,
you should
squat
be in
position. Squat, just like if you were sitting down in a chair, you want to squat. You don't want to bend forward. You want to squat, lift the load, bring the load close to your body, and then stand up.
Bring the load close in.
Close to your body.
And then lift.
And then lift.
Well, because I'm sure you've heard a lot of stories about, and what about lifting and twisting?
So twisting is worse, because when you bend forward, that's one plane. So we call it just like a flexion. But when you twist, you have rotation. So you have a higher chance of like really damaging your disc. So if you're sort of lifting stuff and you're like tossing it, shoveling snow, like a lot of people hurt themselves. They're shoveling, you know, and then they get fatigued. So when we get fatigued, we increases our chance of injury. So think of marathon, and when we're running long distance, our body is breaking down, right? And then they start to have aches and pains. So it's the same. If you're lifting repetitively, like working in a warehouse and things like that, you're more likely to hurt your back.
So in shoveling snow and you've got to lift and twist, what's the best way?
It's to lift and then like step. So don't really do the twisting motion. So lift, step, or just move your entire body, not just your torso with the twisting motion.
Let's talk about also when people are in accidents. Mm-hmm. A lot of times you guys deal with people who are healing. Right. In getting them back into good health. What are some of the most common things you see with that?
Well, with the motor vehicle accident, the most common, of course, is the neck and back injuries, but also shoulders and knees, because people hit their bodies on things in the vehicle. So a lot of times it is the first time they may see a chiropractor, so we use a couple of different things. If they cannot tolerate the manual adjustment with us using our hands, we may use modalities that's very similar to physical therapy, which is like muscle stim, which helps to relax the muscles as well as provide pain relief. We may use ice to control the inflammation, or heat to help promote blood flow to the area, and definitely exercise. I always say the most important thing you could do after an injury is to rehab the muscles. Because everything else feels good, but if you never strengthen those muscles again, your body's not going to be able to support the joint.
Can you say that again?
But you know, the exercises, I always tell patients, you know, the ice and heat going to make you feel good, but you got to strengthen the muscles. You have to do the exercise and the stretching, because your body begins to lay down scar tissue. Scar tissue is like gum, so the body's like, oh, okay, let me put something down, and then I'm going to work on the healing underneath. So you have to break it up. So this way the pain comes, but the body will realign it in a normal pattern, and it reduces your chance of hurting yourself again.
So do you show them what they need to do? Are there specific types of exercises that you need to do?
Right, so in my office, I sort of test, because everybody's different. A person already physically active, they're already used to doing exercises, and they sort of push themselves. Some patients you have to sort of pacify a little bit, but I tell patients, you're going to do exercises. So you like me now, hopefully you like me later when you finish. I said, but the goal is for you, I want to make sure you do it correctly, so that's why you have to do it in the office. Not that I don't trust that you're going to do it at home, but you got so many things to do at home. You got to take care of the kids, you got to cook, you got to clean, so let's do it here, take care of yourself. You know.
And one of the things you do, you give people the tools they need so that they can go home.
Right. The idea is
and do things
so you can be able to manage it. Right. So just like if with the medicine, the doctor's giving you enough so you could be able to get off of it, so they sort of wean you off of it. So the idea is let's get you back to the status where you were functional, or get you better than that. That's the goal. You know, to be able to move it. So I want to give you these tools now. You got to keep doing them when you get home, so you can keep building and getting stronger.
Do you find that people come in thinking there's one thing wrong and it's another? They may come in and say, oh, I got this pain in my neck, but it's something else.
Right. I've had that. So I give you a story. I had a patient who had a car accident. He got hit. His head hit the window. So he was having some TMJ pain, but he also was having some neck pain, because the direct trauma to the jaw caused his jaw was clicking and popping. So me explaining to him the anatomy and how the muscles in your neck connects to the jaw, that if we could get this neck to work properly in his jaw, all of this will heal better. You know, so a lot of times something as simple as that.
So it's 20 or so years ago, I heard about TMJ. I had some issues with that. A lot of times we're like in our sleep. Right. We're grinding our teeth in our sleep or whatever, and it's causing headaches, it's causing all of these problems. Sometimes we don't even know we have it. But how can chiropractic medicine help with that, the TMJ problem? And explain first, what is TMJ?
TMJ, so it's abnormal movement of the jaw or pain in the jaw. So it could be clicking, it could be popping, or just, it just hurts, you know, there. So traditionally, if they will go to the dentist will do more of sort of injections like that to help control the inflammation and things like that. But with chiropractor, we use our hands and we use things to help mobilize the joints. Anytime there's an injury, you got to remember the body's going to lay down scar tissue. So scar tissue is not normal tissue, and the joints are not going to move properly. So with chiropractic adjustment, it helps to break up the scar tissue so you can move properly, and that includes the jaw. You know, so doing soft tissue work, because those muscles are really trying to stabilize the joint, relaxing it either through massage therapy or something like that, and then showing corrective exercises to get your joint to move properly.
So you do jaw exercises?
Right, doing very specific jaw exercises.
And One of the main things, we've talked about people who are dealing with back issues. That's one of the main things as a yoga teacher. People come in with back issues, but I tell them that the yoga is not the be-all, end-all with that. There's other things that you need to do.
Right. It's a tool. You know, yoga's a tool, chiropractor's a tool, medicine's a tool to help get you better to where you want to be. And a lot of people use yoga because they don't want to take the medicine. Yeah, I don't want to take the pill every day, but you have to do something. That's the movement, right? Because when you're doing yoga, you're strengthening and you're stretching the soft tissue, and that's how you're going to get better and decrease, you know, the symptoms.
So you were talking about that there are some machine. What does lengthening the spine do with these different machines or different devices or even manipulation? What does that exactly do? Okay,
so the spinal adjustment is a very specific movement that is applied to the spine. Chiropractors, we use our hands, so it's very quick, and the reason why it's quick because your body's going to tense up, so we're trying to override that reflex. And when we do it, we help break up scar tissue right around the joints. And that's the idea to get you better. When your joint is not moving properly, just think if you were to put your foot in a cast or something like that, it's going to be muscle atrophy, meaning the muscles are going to get smaller. There's going to be inflammation because you're not moving. And as a result, the tissue is not going to function properly. You're not going to be able to bear weight. The same thing with the spine. When there's an injury, you get hurt, there's inflammation, there's swelling, you don't move well. So that's what the adjustment does. It helps to move you better. That way the inflammation and swelling gets out of the way, and now you're able to function properly.
What's the success rate with things like that? If you do the manipulation, does it last? Is it something that's permanent? Is that something you need to treat every month, every year? How successful is it?
So it all depends on what's going on with the patient. So if a person who is already physically active, they're pretty good shape, and they say, doc, I just want to get checked out. So we just check them out, just seeing how they're moving overall. So what I do when I do screenings, I do like a functional movement assessment. I want to see how well you squat, and see how well your shoulders move, because the muscles that's in the lower back, it connects to the thighs, as well as the muscles that connect to the shoulder that come off of the mid back. So if you don't have really good shoulder range of motion, more than likely the middle of your back is not moving well. Same thing if you're not able to squat really good or deep, your lower back it's not moving well. So that's something I'll do for a person who has, they don't have any pain or any symptoms. Now, if a certain person come with symptoms, so it's very different. Well, how long have you had it? How'd you get it? You know, did you wake up with it? Do you sleep like 5 pillows? Do you sleep with no pillow? Do you sit all day? So it's just really seeing what's going on with the person. How long will determine like the treatment plan. And then if they have any underlying conditions like either like arthritis or diabetes, which can affect how well they will heal.
And arthritis too, my mother suffers from rheumatoid arthritis, and it's such a catch-22. It's better if you exercise, if you move, but it hurts.
But it hurts, right.
How do you overcome that?
So so the arthritis is inflammation of the joint. So the joint is inflamed. So with the rheumatoid, it's sort of like the body like doing something weird and attacking itself. So that's the rheumatoid, but we also have osteoarthritis, which is usually seen in the weight-bearing joints, so like the knees, and then the back. So when you're moving around now, if there's changing in the structure, the thing is going to function different. So it's the same. If you have a pencil and you take the lead out, well, it's a pencil, but it's not function as a pencil. So that's the same thing. When you have degeneration, it's going to behave differently. So now you have to sort of modify certain things. But one of the ways, yeah, it hurts to move, but you got to move. Because if you don't, you'll get stiff and the muscles will become weak. So that's, you say, it's the catch-22.
So do you deal specifically with patients who have arthritis?
A lot of people have arthritis, especially once we reach a certain age, because just of the weight that we have gravity that's constantly on us. Then we have, when we're children, running around playing, then we sit a lot. So that's a lot of wear and tear on our bodies that will show up again, like I said, later.
And so what do you do with them? How do you work with them?
So if there's degeneration of the joints, there's not much I could do. The idea would just prevent it from becoming worse. So if a person is overweight, the idea is to help. Okay, let's get you on a better diet, lose some weight, because you're putting a lot of pressure on those joints, especially the knees and the lower back.
That was my next question. What is weight? have to do with the way your spine functions?
So the difference between, say, when a woman gets pregnant, she sort of gains their weight rapidly, so her body doesn't have time to adapt to it. So her ligaments are being stretched, the muscles. Whereas a person who gradually gains the weight, their body has time to adapt. So they may not feel back pain, you know, or lower back pain until their body's like, okay, I had enough. Because the center of gravity is just going there, so they're usually leaning back. Because if they set up, they'll tip over because of the weight. And when you pull in the spine forward, it's in an abnormal position. Now gravity, which is coming down on us, is putting a lot of wear and tear. And so over time, the degeneration will happen. And so then it will show up. And now they will have pain.
And so what can you do? And one of the ways, of course, would be to take off some of that weight.
Right.
What are some of the other ways, or how important is it to take care of your spine if you are obese, or if you've got some weight issues?
Well, it's inflammation too. So I recently read a research article that said that with the obesity, it's a low-grade inflammation that's in the body. And if we believe that all of disease is from inflammation, then we need to control inflammation. So that's diet, exercising, and moving around. So reality is you can do all the chiropractic care you want, you can do all the yoga you want. If you don't lose the weight, it's going to come back. So that's the reality. Like, you have to really get your weight in a manageable position where you're able to move around and not really put a lot of weight on your joints. Especially, I always tell people, if you lose weight and your knees hurt, your knees are going to feel a lot better.
And do you come across people with knee? Because I know that's one of the major complaints. People come in and say, oh, my aching knees.
Right. So one of the things I do once a month, I do a free foot scan. So the scan, I say the foundation of your structure, which is your body, begins at your feet. So if you're wearing shoes that are run down, way down, it's going to make your feet roll outward, which is going to put abnormal wear on your knees. Now, again, it's not like a direct impact like, oh, I fell down, I fell into my knees, but it's over time, the repetition. Now you start to develop knee pain. Now you start developing hip pain. Oh, now my lower back hurt. Now my mid back, because it's this chain that goes all the way.
So what does that assessment do? What do you?
So what happens is it measures the arches of your foot. So once the arches fall, because it's nothing but connective tissue, it's not, you have the bones and they have connective tissue. So once they fall, then it tells you where, and then the idea is to put customized orthotics that fit specifically for you. I actually wear them because I was having plantar fasciitis, what people complain about, you know. But I tell you, when I put the orthotics in, I don't have any pain in my feet.
And change your shoes.
You have to change your shoes. You can't wear
run down. I know they feel
good. I mean,
good.
I've seen people lay on the table. I said, come on, you know. I say, listen, you know, I understand these boots cost a lot of money, but you got to think, what is it doing to your knees and what is it doing to your feet? So what the orthotics, it doesn't correct it, it just gives your body support when you need it. It's when you're standing, when you're walking, when you're running, that's when you need the support.
Do you need to get special ones, or can you get the ones now that you buy in the store? Is it best to get fitted?
I would say get fitted, and to do it in a weight-bearing position, because you need support when you're standing, because your body changes when you're standing. When you're sitting, it behaves very differently. So the ones in the store, they're sort of like generic, and they're kind of hard, not as flexible as the ones you would get like from the podiatrist, or like I said, it's something I do in my office as well. So it's better to do it that way.
I know I have flat feet. Yeah, like no arch.
Right.
And that makes a difference to know what kind of foot you have.
This is true. Because again, a person may not feel pain, but over time, they may start to feel, because just like if someone is sort of pigeon-toed, or we used to call the slew foot.
Yes,
you know,
slew foot.
You know, so they don't feel it, but after a while, when they're pigeon-toed or bow-legged, they start to have knee pain over time, right? It's cute when they're children, but when they get in their 20s and 30s,
yeah, because I know as a teenager, we like boys who were bow-legged.
But they have knee pain. Later in life, they start to develop knee pain, and I've seen it in practice.
So in wrapping up our discussion this morning, for people who fear chiropractors, what would you tell them?
Just talk to a chiropractor. You know, chiropractors are very friendly, we're very hands-on with our patients, because they come see us, because it is rehab, meaning they're seeing them more of the time, more than once a week. Then we really have a good rapport. So I'll say at least call if you have talk to a chiropractor, ask them questions, don't ask your friends. you know, talk to someone who actually went to a chiropractor. Because some people say things about chiropractic, but they've never been
their
to a chiropractor.
cousins, sisters, brothers, father went and didn't have a good experience.
Right. So a lot of doctors like myself, I offer like free consultation, so you can meet me and say, hey, look, maybe I can help you, maybe I can't, but at least you get to see, you know, what's going on with you.
What do you say to folks who say, well, my insurance may not cover, we're not going to talk about insurance companies or anything like that, but what do you recommend to people who are concerned about the whole insurance aspect of it?
So I would say, one, call your insurance to see if you actually have coverage. You can always get a referral from your physician to go see a chiropractor, and we accept cash and credit just like anyone else. So,
and what about people whose doctor, this person might want to come, but the doctor doesn't believe?
So I would say, you know, if you find a chiropractor and say, do you mind talking to my doctor? Because, you know, sometimes they don't study, you know, chiropractic, they don't study like acupuncture or these other things, and themselves, they may never go, even if they may need it, you know, because we're all humans. Like, I have shoulder pain sometimes I have back pain, and I go to who I need to go to. So I would say, ask your chiropractor if they mind talking to, or give them some literature, some research, or they could do it themselves as well, just to give a better understanding what chiropractic is.
And just do your homework.
Do your homework. Become a better, I always say, become a better patient, you know. Ask the doctor questions, because we don't know, you know, and if I don't know, I'll say I don't know, but I'll find out, you know, I'll do the research and I'll do articles and things like that. But, you know, really ask questions, because if you've been taking medicine and it's not working, the reality is you need to do something different.
And, you know, I truly believe that the future is a combination of the traditional medicine with holistic.
Right.
Medicine. I really feel, I see so many major universities, major hospitals moving in that direction now. It's not like it used to be.
Right, which is so good, because now you're thinking more about the patient. So when the patient becomes the center of the care, you're doing everything you can to help them. So I don't manage diabetes. I cannot treat diabetes. So I need to go send you to someone else. I can't manage, you know, certain things, you know, the dental issues. I can help with your TMJ, but I can't help with your teeth and what's going on in your mouth and stuff like that. So it's just having a really good healthcare team as a patient, and everybody be in communication.
And before we go, let's mention the name of your book one more time.
Okay, The Adventures of Joshua Spencer Spine and the Back Attack.
And it's for kids, what age?
Ages, I would say the babies all the way up until about 12 years old.
Very good, very good. Dr. Tiffany Butler, it has been an absolute pleasure. You're a chiropractor and you deal with the health of the spine.
Yes, ma'am.
And it's been a pleasure having you here.
Thank you. Thank you.
You've been watching the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Have a great day. Oh, and I need to sit up a little bit because I feel like I'm slouching and I don't want to get in trouble with Dr. Butler. This has been great.
Well, thank you so much. Thank you.